This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to answer a question that I've been asked a lot, which is, how do I relieve my SI joint pain? Well, first off, what is the SI joint? SI joint stands for the sacroiliac joint, and it's where your spinal column connects to your pelvis. So you've got two large sacroiliac joints on each side of your spine. Now, the problem with SI joint pain is oftentimes people have what they think is low back pain, which is actually SI joint pain. They're next to each other, and they can often get confused. So the first thing that you have to do is you got to get an accurate diagnosis to determine, is this really what my pain is coming from? Low back pain presents slightly differently than SI joint pain, but most people say, yeah, it hurts right over here. It's a similar sort of spot. So you need to see someone who knows what they're doing. Low back issues can oftentimes show up on x-ray or MRI. SI joint stuff doesn't really. So that's the first step, get an accurate diagnosis. Once you've done that, then you can start figuring out how you want to treat it. So why does the SI joint hurt? Well, it's hard to know exactly, but the theory is that the joint becomes unstable as the muscles around it get weak, and that causes extra inflammation of the ligaments in the joint capsule. So the first step, really, anytime someone has SI joint pain, is to send them to physical therapy. And what the physical therapist will do is they'll work to strengthen the muscles around the joint to make sure that it's nice and stable, and that should calm the inflammation down. You can also take anti-inflammatories as long as you're healthy enough to do so. So, seeing a therapist is good. If you can't, then, do home exercises. Watching a YouTube video can help as well. You can always find PDFs of these exercises that your therapist is going to give you anyways, although it does help to work with an actual physical therapist. All right, so that didn't work. So what do? Well, the next step that I recommend if someone's really having pain there is to get a corticosteroid injection, or steroid injection, same thing. And what that'll do is put steroid medication in that joint and calm the inflammation down. Now, you need to work together with therapy, because the whole problem, the reason why it hurts in the first place is because things got, your biomechanics got off. So it needs to be in concert with therapy, but it can certainly give you a boost. I do it all the time for my shoulders and whatnot. If you do get a steroid injection to your SI joint, it needs to be done either under ultrasound or x-ray imaging, because just doing it blind, it's very difficult to get in. Their success rate's about 20%. So if someone's going to give you an SI joint injection, they don't use any imaging, I'd be highly suspect of whether you should actually get it. Usually between that and physical therapy, that does the job. Now, if that's still not working, then you're looking at other things. I've heard that sometimes people will get something called a pelvic belt, which you can get on Amazon for about 20 to 30 bucks. And that wraps around your pelvis, and that can supposedly stabilize your SI joints. I don't know how well they work, but certainly if that's something you want to try, you certainly can. Then you kind of start getting into stranger things. Some people try prolotherapy, which is when they inject sugar, inside a joint, and that scars everything down. I don't know how well that works. Never done it, never ordered it. The other one is radiofrequency ablation, where they go in with a probe and they deaden the nerves. That can work really well in the spine, like lumbar spine, cervical spine. The problem is with the SI joint, they're not getting to the front of that joint, so it's questionable how well that works. And then if everything else fails, then there's the option of surgery for fusion. Now, in orthopedics, if a surgery is really good, there's usually 1 to 2 ways to do it. With SI joint fusions, there's like dozens. So that just shows that we haven't figured out a great way of doing it. So some people get great relief, some people don't. Definitely that should be the last step that you want to take. But for some people, it does give them good relief. So those are the kind of courses you follow. First, most important thing, get an accurate diagnosis, then try physical therapy. If that doesn't work, you can try steroid injection among some other things. So I hope that answered your question on how to relieve your SI joint pain. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll be happy to answer them.